So this is NBC's Kirsten Welker with Hakeem Jeffries, reminding Mr. Jeffries how Democrats used to oppose a shutdown. He didn't respond to her point. Number 10.
But let me ask you, because you say this is a Republican shutdown, but it's Democratic senators who are withholding their votes on what is called a clean resolution. That means no strings attached, which is something, quite frankly, Leader, that you and other Democrats have advocated for in the past. Take a look.
You do not use the threat of shutting down government to try to advance your policy agenda.
First thing that the House has to do is pass a clean 6-week CR.
A continuing resolution that is at the fiscal year 2023 levels is the only way forward.
Why not fund the government and debate extending Obamacare tax credits after the fact? They don't expire till the end of the year.
Well, what we've called for is a bipartisan negotiation where Democrats and Republicans can sit down in good faith, reopen the government, pass a spending bill that actually improves the quality of life of the American people in an environment where the cost of living is already too high. Republicans promised to lower costs on day one. Costs aren't going down, they're going up. And if these Affordable Care Act tax credits are allowed to expire, premiums and health care costs are going to skyrocket. And America is already too expensive for the American people because of the Trump failed policies, the Trump tariffs, and this will make things worse. So we just want a bipartisan negotiation that addresses the health care crisis at the same period of time with the fierce urgency of now.
Fierce urgency of now. So he didn't answer the question, why have you guys done the 180 on supporting a clean resolution to continue the government while you worked out your differences as you did before, but now you've changed your mind? And of course, they keep claiming that illegal aliens don't get any government dollars, don't get any Medicaid dollars. Press Secretary Caroline Leavitt explained exactly how illegal aliens do this. Number 2.
Are you denying that Medicaid money has never gone to illegal aliens in the United States of America?
I'm not denying anything. I'm asking you if you can explain the disconnect in the message.
I most certainly can. The Democrats' proposal, their continuing resolution, let me just reiterate, the Republicans' continuing resolution was a clean continuing resolution. There was no partisan politics injected into it. There were no conservative wish lists injected to it. What the Republicans want and still want to this very second is a clean continuing resolution to fund the United States government. What did the Democrats want in their continuing resolution? They inserted a provision to undo a provision in the Working Families Tax Cut, the One Big Beautiful Bill, that ended taxpayer-funded health care illegal benefits for illegal aliens. Democrats' proposal would require Medicaid to pay more for emergency care provided to illegal aliens than Medicaid does for American patients who are disabled, elderly, or children. And this bill would have also allowed California to continue a gimmick that funds its Medicaid for Illegals program. Those are things that we ended, the Trump administration ended, with the passage and the signage of the One Big Beautiful Bill. And it is an undisputed fact, a fact that under the Biden administration, illegal aliens were absolutely receiving taxpayer-funded health care benefits. In fact, in fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion. That's $9.1 billion taxpayer dollars that were going to emergency services for illegals. Between President Trump's last full fiscal year under his first administration and Joe Biden's last full fiscal year, Medicaid spending on emergency services for illegal immigrants nearly tripled. There was an increase of 196% between 2020 and 2024. And I have a chart here for you, and I'm more than happy to email it to you. I'd also like to add, because some were asking dishonest questions yesterday about emergency rooms. In Southern California, according to healthcare professionals in 2023 under the Biden administration, Southern California's, quote, entire healthcare system was being bombarded with illegal immigrants and forcing American patients to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health system in 2023. leaving an uncompensated bill totaling over $10 million. So when a legal alien goes to the emergency room, who's paying for it? The American taxpayer. The main safety net hospital in Denver had to turn away patients due to the massive influx of illegal immigrants into the community. And UC Health Hospitals in 2024 reported their system was under stress from an increasing number of migrants. As a result, according to the head of emergency departments and urgent cares across the hospital system, quote, access is impeded for everyone. These are healthcare professionals who dealt with this directly, and there's a lot more where that came from. It is an undisputed fact that Democrats want to give taxpayer-funded healthcare benefits to illegal immigrants, period.
Who do you think pays for all this? And there's an emergency Medicaid fund. What California does is through accounting maneuvers, reroute money through that so they can take money out of that, spend it over here, spend it over there, spend it over there. Taxpayers are paying for this. So this lie that illegal aliens by law cannot get Medicaid money, there are many ways to go around that, and that's what states are doing. Blue states are doing that. And California is one of them.
For full shows, live and on demand, it's Salem News Channel.